Hello. Today our subject is also about a beautiful smile, but the question is whether it's possible to have a straight teeth and a beautiful smile without having a correct occlusal relationship or a correct bite, or the answer to the question which we have from some of our clients, is it possible to just straighten my teeth and have a beautiful smile without fixing the occlusion because I don't want to spend longer time with the brackets. The question is that a beautiful smile and straight teeth is always guided or maintained by certain factors that stabilize this relationship that we achieve. One of the most important factors is the correct occlusion, correct stable occlusal relationship or bite. Today I will talk about the factors that guide us to a good occlusion, to a stable occlusion that in its turn, protects and stabilize our straight teeth and beautiful smile. The first important factor in a good occlusal relationship is the relationship between the canine, which is the tooth number 3 in the upper arch, on the right and left on the midline, and its relationship with the lower canine and the tooth number 4 in the lower arch. The upper canine at the end of the treatment should be in the triangle between the lower canine and the tooth number 4. This is very important in mastication, very important in eating, in talking, because of the relationship between the upper canine and the lower canine that is described or that is manifested as a sliding process between the upper and lower canines. The factor number 2 is the relationship between the upper anterior teeth and the lower anterior teeth in two factors, overjet and overbite. Overjet is the relationship in this direction between the upper and lower teeth. Overbite is the vertical relationship. For the anterior and posterior relationship, the upper teeth from inside should have a slight contact with the lower anterior teeth when we close the bite like this. The other factor, the overbite, the upper anterior teeth should cover around 2 millimeters of the lower anterior teeth. This is what when we have or which indicate a correct anterior relationship after the orthodontic treatment, which in turn guide to an important factor of occlusion called the anterior guidance. Factor number 3 is after finishing or in the last stages of the orthodontic treatment, we plan to have a perfect contact relationship between the teeth in every arch. So the relationship between the tooth number 1 and 2, 2 and 3, 3 and 4, which is the contact between these teeth. Every tooth with its neighboring tooth should have the contact between them at a specific distance from the underlying bone. This will in turn maintain and achieve a beautiful gingival appearance, will ensure a proper positioning of the teeth, and gives a healthy, beautiful smile without causing also any of the problems of food impaction. Food impaction is a very unpleasant problem that can happen after orthodontic treatment if not planned well, if we didn't plan this relationship between each tooth and its neighboring tooth. The factor number 4, which we always have to look at after finishing the orthodontic treatment and before debonding of the brackets, which is we ask the patient to make a panoramic x-ray. This panoramic x-ray, we look at the roots of the teeth. The roots of the teeth should be parallel to each other, except for the canines number 3, tooth number 3 and tooth number 3. The roots should have a slight mesial tip, slight tip to this direction and this direction for a more beautiful relationship between the upper and lower teeth, and a better relationship between the upper and lower canines. So these four are one of the most important criteria for having a proper occlusion, a correct result after orthodontic treatment, which in turn help us maintain and stabilize the result that we had after the relatively hard work that we did during the orthodontic treatment. I hope my video answered a lot of your questions, and more questions I'm ready to answer. Thank you.